Tai Chi versus General Lower Extremity Strengthening and Preventing Falls in Community-Dwelling Older Adults by Rachel Ballish and Madison Burris.
We introduce our critically appraised topic with this clinical scenario. We know that falls in elderly adults ages 65 and older account for increased morbidity and mortality rates. It's a huge problem, and according to the CDC, more than 1 in 4 adults over 65 will fall every year. Additionally, healthcare costs are tremendous, reaching $31 million in healthcare costs per year. I think the challenge right now with falls and preventing falls is that there are a lot of prevention programs and interventions out there, but what's the best one? And so our PICO question, our clinical question, stems around, is there a best prevention program? So our question is, for community-dwelling older adults, does the use of Tai Chi reduce the future risk of accidental falls compared with general lower extremity exercise programs?
Our search strategy followed our PICO terms. Patient group was community-dwelling older adults. Intervention was Tai Chi fall prevention program. Comparison was traditional lower extremity strengthening program. And outcome was the number of falls compared with the traditional lower extremity strengthening program. Our sources of evidence searched included the CDC website, EBSCO, CINAHL, PubMed, and Scopus.
Continuing on in our search strategy, the inclusion criteria we used were level 2B evidence or higher, studies using Tai Chi fall prevention programs, and articles limited to the past 6 years. Our exclusion criteria were journals not listed as scholarly peer-reviewed journals, publication dates before 2014, and studies performed on adults that were not community-dwelling.
In our search for evidence, we used the keywords exercise, falls, older adults, and Tai Chi to narrow the results. 307 possible studies were identified, and the first 50 were listed by relevance. We searched those to find 9 that matched our inclusion criteria, and then found 3 that best matched our PICO criteria. All 3 studies reported significant positive effects of Tai Chi when compared to general lower extremity strengthening.
So looking more closely at best evidence results, 3 of the studies we included were all randomized controlled trials. Participants largely involved older adults, and again, we're mainly focusing on Tai Chi versus some kind of lower extremity training. And there's a little bit of variability here throughout the 3 studies, but they're very similar. In terms of outcome measures, the Huang and Lee articles both looked at incidents of falls in terms of self-reporting by participants, whether that be through a calendar system or a daily journal. And the Yildirim article looked primarily at outcome measures that are primarily looking at, okay, what is your fall risk? So those included static balance, dynamic balance, and fear of falling. Some examples are, single leg stance, eyes open and eyes closed, the tug, the Beck depression scale. All of those were assessed in participants at the beginning of the study and then at a 12-week follow-up.
In the Huang article, they found that participants that were in the Tai Chi group were less likely to have experienced a fall both of the 6-month and 18-month study markers. In the Lee article, they found that falls were reduced by 31% for the intervention group, and in the Yildirim study, they found that there were significant differences in all outcome measures for the intervention group. However, the computerized balance test assessment did not prove to be statistically significant. The Huang article was the only one with a level of evidence of 2B, and the Lee and Yildirim groups were both at 1B. The validity scores overall for these articles were pretty high. Yildirim was the lowest at 21, Huang was at 24, and Lee was at 30. Huang's conclusion was that home-based Tai Chi may limit falls to a greater degree than traditional lower extremity strengthening, and the rest of the studies followed in the same footsteps.
All right, so I'm going to briefly talk about some strengths and weaknesses of the studies we found, in addition to some implications to practice and future research. So some of the limitations that the studies reported involved self-report bias. This had to do with the false incidence diaries that participants were keeping. There's just going to be some room for error there. Additionally, overall, in terms of demographic data, geography, lifestyle habits, all of those factors, there were some studies that just didn't have enough diversity, and so that could potentially affect the generalizability. Additionally, transportation was an issue in terms of sometimes getting participants to a Tai Chi class or to a lower extremity training group. Some of the strengths we noted were the study's efforts at limiting attrition, and so mainly these were via reminder phone calls. And, since a lot of times home-based exercise programs were being employed, I think this is something that's very translatable to physical therapy practice because we know compliance can be an issue, so I thought that was interesting to note in terms of something we can learn here. Additional implications to practice. The validity scores are really high here, so that's good news in terms of, there being potential that Tai Chi could really be a good mechanism for reducing falls. I think a big thing here now as physical therapists is, all right, how do we educate the public on this? How do we, make connections and partnerships with the local community, and to see how we can really promote Tai Chi. In terms of future research, because of the exclusion criteria, limiting those with comorbidities, I think it would be great to see exploration into the effect of Tai Chi on those with major medical conditions, because it's difficult to apply these results to those people with neurological or cardiovascular problems, because again they weren't included in the study.
The clinical bottom line. According to these studies, Tai Chi is superior to traditional lower extremity strengthening exercise programs in preventing fall risk in the older adult population. However, it's important to remember that every study has its limitations and every patient that walks through the door is different. These studies show promise that Tai Chi is beneficial in preventing falls, but it's important to be holistic when designing a plan of care. Individual patient deficits and interests should be addressed in the plan of care, but implementing some elements of Tai Chi would likely be beneficial for most patients.
Here are our references. Thank you.